People are just not afraid enough of the diseases that vaccines prevent. And that's not really their fault. I mean, vaccines have been so effective at what they do that whole generations, even of doctors, may or may not have seen these horrible diseases. So let me show you some of the cases that I've seen in the last 10 years as a pediatrician that have made me scared of the diseases that vaccines prevent. So this up here, that big ball in the middle of that person's brain, is an example of Haemophilus influenza B meningitis. Now, I've taken care of children who have so much pus around their brain that they are seizing nonstop, which causes us to need to put them in a medically induced coma to protect their airway, because the bacteria from the meningitis has infiltrated every part of their brain, oftentimes causing abscesses like this. Here we see a case of pneumococcal pneumonia caused by strep pneumococcus. In an unvaccinated patient, this bacteria can take over whole lobes of your lungs, build them up with pus, displace normal lung tissue, and actually obliterate normal lung tissue. It's also very commonly the main cause of ear infections and even meningitis as well. Here's a current thing we're having an outbreak of: measles. And up to 1 in 10 kids can have pneumonia, just like we see in these lungs here. All those white patches in the lungs, that is all pus and inflammation from measles-induced pneumonia. This is a little tiny infant who couldn't be immunized yet, who developed pertussis or whooping cough. Whooping cough in infants often cause them to lose the stimulus to breathe, meaning they'll just go apneic and stop breathing. And if they are breathing, sometimes the work of breathing is so much that they have to be placed on a ventilator like this child to breathe for them. Finally, this is encephalitis or inflammation of the brain from chickenpox or varicella. Now, chickenpox, even me as a kid, was very, very common, but there are up to 1 in 100 to 1 in 1,000 children that will have very severe complications such as pneumonia or encephalitis from chickenpox. The problem with vaccines is that they are so good at what they do that it takes such a short amount of time for us to eliminate those diseases from people's memory. But 100 years ago, even the time of our grandparents, the top 3 causes of death in the United States were all infectious disease: pneumonia, tuberculosis, and diarrhea illness. And then all of a sudden, 100 years later, infectious disease is the number 6 cause of death in the US. And if you look at similar trends in children, it's even more dramatic. Now, this isn't fear-mongering over diseases. This is sharing real-life experience from somebody who takes care of kids that are afflicted by vaccine-preventable diseases. And it is scary. We do not want to go back to a time where the number 1, 2, and 3 causes of death are from infectious disease. We do not want to go back to a time where 50% of kids died before the age of 2. We do not want to go back to a time where getting a fever is considered a chance of death.